As always, we are happy to be joined by Dr. Syed Hussain from Trinity Health in New England to talk about some of the big stories that have come out in the past week in the health world. Good to see you again, Doctor.
Good to see you too, Tim.
Pleasure to have you. Got a lot to talk about. First things first, looks like last week we touched on researchers finding a new gene that is at least linked to Alzheimer's disease. I guess it's a combination of two genes that could be part of the underlying cause for some of the people. I know that's a lot of qualifiers here. So what do we know and what do we not know?
Yeah, there's been a lot of focus and research in this arena, Tim, as you know. So I'll remind viewers, in 2010, we had about 10 gene areas that we knew were associated with the development and progression of Alzheimer's. We're now up to 80.
Okay.
So this adds to that growing body of evidence. We still don't have a cure per se.
Right.
We have disease, we don't even have disease modifying agents. We have symptom relief medications that are available, but
Okay.
we don't have anything yet that will actually bend the arc in terms of, you know, the disease progression for Alzheimer's.
Right.
But, you know, there are promising trials and medications that are being looked into. There's also no screening test per se, no genetic test that is widely available for people. People who may have a family history of Alzheimer's, especially early onset, may want to talk to their provider to see what options they have. Do they qualify for any medications? Is there a new medication that got approved? Just to remind viewers, last year by the FDA, which was promising, first in many years.
Yeah.
So, but more to come on this. It's a hot topic, obviously, but we still don't have anything in terms of a screening test or medication.
But it's good to know more. I mean, we're seeing in other
Absolutely.
areas where gene therapy is starting to flourish, so hopefully someday with Alzheimer's
That's right,
disease.
especially with precision medicine.
Yes, that's the idea. All right, moving on. The Centers for Disease Control and Prevention released new data show show drowning deaths in the U.S. are on the rise. Let's just show some statistics here. The rates of accidental drownings have gone from about 500 a year up to about, up by 500 or 600 a year. Preschool age drownings have gone up 30%, and about 15% of U.S. adults still can't swim. We hear over and over again, just access to basic swimming and water safety training helps with this issue. There's a lot of common sense things here. Wear a life jacket, things like that. Make sure there's a buddy system. What are some less common sense things that people might want to know about when it comes to preventing drowning?
Learn CPR. As we go into spring, summer, everybody would want to be in the water.
Yep.
If you have a pool at home, make sure there's a fence. Make sure there's supervision, like you mentioned. There's a buddy system. Make sure if you're on certain medications that can cause drowsiness, for instance, that you're not hitting the pool after that. Don't try to play games in the water, such as holding your breath. You may pass out and drown.
That's my oldest son's favorite game.
No, that's a no-no, Tim. So common sense things work, but going back to the first point I made, American Heart Association, for instance, does offer CPR training online and in person. You should get certified. It can save lives.
Yeah, you don't even, they do compression-only CPR now.
That's right.
They've been doing that for years. So honestly, some people were a little too icked out and grossed out by having to do mouth-to-mouth. You don't have to do that, so that's a great way to
One more
learn
thing,
CPR.
Tim, is a life jacket.
Yes.
Especially for children.
Yeah.
In the age group 1 to 4 years of age, drowning is the most common cause of death. So the onus is on us as adults to make sure that we provide that safe environment.
And as a parent of a young one, yeah, I imagine a lot of you out there, absolutely, just this fear of drowning is one of those persistent ones that's always in the back of your head. All right, it's also Mental Health Awareness Month. The rise of talking to a therapist, a psychiatrist, psychologist is becoming more common. How about this? A study found that virtual mental health visits jumped from only 2% in 2019 all the way up to 35% last year. Undoubtedly pandemic-driven, one of the good silver linings we've seen here. What are the advantages of virtual mental health visits?
You could stay at home and get it done, especially if you have transport issues or if you live in a remote area where you don't have ready access to mental health care. We know how big of a problem it is to get behavioral health providers and appointments. So what I would say to viewers is if you do have the opportunity, please make sure you use it.
Yeah.
Get online, get that appointment scheduled, have a list ready so that when you talk to your provider or therapist, you know what items to go over, what to review. If you feel uncomfortable, Tim, you may have a friend that may join or maybe with you in person. So all things to consider, but it is important that you actually get that appointment made if you can't see someone in person.
Yeah, it seems like it's just tailor-made because you don't have to have them necessarily look at like a lesion adhesion on your body. But that's not the first time I've heard it. Make sure that you feel like you've got a good rapport and a good fit
That's right.
with your therapist. So don't be afraid to say it's not necessarily for me, but it doesn't mean the therapy doesn't work. It just means you just haven't found that right fit.
That's
All
right.
right, Dr. Hussain, thank you so much.
Thank you. Thanks,
A pleasure. Dr. Syed Hussain from Trinity Health in New England, always a wealth of knowledge. Erica.